Hey guys, it's Dr. Cameron Dennis, physical therapist for Back on Track Therapy and Wellness. And today I wanted to get on and talk a little bit about patellar tendinopathy, or it's also known as patellar tendinitis. I'll get into a little bit about why I call it patellar tendinopathy shortly, but let's go ahead and make sure that this video is working. If you get on, please let me know if the sound is working. Hey Lance, would you be able to let me know if the sound is working? My last video, the sound didn't work, so if you happen to be on and you're watching, can you let me know if the sound is working, so I don't waste my time with this video. Just waiting to see if anybody can hear that. For some reason, I'm not able to see this stuff, so let's see. Okay. Well, I suppose we can go ahead and get started. If it doesn't work, I can always do it again. That's okay. So, like I said, we're going to talk about patellar tendinopathy, which is irritation or pain in the tendon that attaches the kneecap to the front of the tibia. So if you're not familiar with that, I'll pull up my pant leg here and you can take a look at where that is. Okay, so here's my knee. Right, here's the patella. It's also known as the kneecap. Okay, there's a tendon which attaches from there, the bottom of that, to the front of the tibia, and you can actually feel that little tuberosity there, that little bump, and it attaches that. And basically what it does is that between that and the kneecap, it allows for you to produce more force in the quadricep muscle with knee extension. Okay, it creates an increased lever arm for the quadriceps so that you can produce more force. Okay, gives you a mechanical advantage. So when you are weightlifting, when you're running, sometimes if you take a funny step or something, you can irritate that tendon. It can cause pain in that spot that I showed you, and we call that patellar tendinopathy. So this can be an acute problem, or which means it's something that happens suddenly due to something that has just happened, like one occurrence, or it's something that can be brought upon by multiple offenses. So going from running 10 miles a week to running 100 miles a week, you know, that's just an extreme example, but that can cause problems with the patellar tendon because it's not prepared to accept that load. So we know that the patellar tendon and other tendons in the body don't have a lot of blood flow, so they do have a little bit more difficulty healing than, for example, muscles might. But in the same way, we know that they're not tendinopathy, or what you might call tendinitis, is not actually a inflammatory response. It's not going to be like a swelling, so to say. So like, you know, if you strain your quadricep, you might have a little bit of inflammation in that area. You're not going to have this. You're not going to have that with tendinopathy, okay? The reason you're having pain is because the tissue is irritated, so the nerves are sending signals to the brain telling you that it's painful, okay? That makes a big difference. Okay, this is something that is new with current research. So with the change in our understanding of what's actually going on with tendinopathy, that changes the way we treat it, okay? If it's not an inflammatory response, is icing going to make a big difference? We don't know. Is ultrasound going to make a big difference? Hot packs. The reason that it might help would be to alter that nerve signal, but it isn't really changing the blood flow to those tendons. Okay, that's something that we know from research. So, how can you know that it's tendinopathy and not something else? Hey, Andrew, how you doing? Thanks for watching. If you didn't catch it, we're talking a little bit about patellar tendinopathy, the causes and how we can treat that, specifically in runners and weightlifters. So, identification of the patellar tendinopathy is unique because with tendinopathy, it's as you're when you first start, it might be more painful than 20 minutes into the run. Okay, so it's different than a lot of the other injuries that you might have of the knee that actually get worse as you go. You know, you might have someone that says, well, I don't really have any pain at the beginning of the run, but as I go, that's when the pain really starts to go after mile 2, for example. With tendinopathy, it's actually the opposite. You're going to have more pain when you first start, and that pain's going to actually go down as you go. Okay. And as far as I know, the mechanisms behind that isn't well understood. But that is just one way that you can identify that that's actually what's going on, that it is actually a problem with the tendon. So now that we know what it is, we know where it is, how do we treat this? So typically what you'll see in a lot of physical therapy clinics will be massaging the tendon, doing ultrasound to the tendon. You might even see things like the Graston. I don't know about drag needling, it's possible. Personally, I don't do a whole lot of manual therapy myself. I'm a firm believer in getting people moving, loading the tissue that's actually having problems. Doesn't mean those other things don't work, okay? It's just not what I personally use in my treatments. So what I do is, I guess, one thing that we know that works is isometric training. Okay, that means you're contracting the quadricep muscle, but you're not going through any range of motion. Okay, several different ways you can do that. A wall sit is a good example of something you can do for that. And that's something that you can actually change the amount of weight that you have. I mean, you might even sit, you know, a 10, 15, 20 pound weight on your lap, and that increases the load a little bit. But what we know is that isometrics have what we call an analgesic effect on tendons and tendinopathy. So if you're having a lot of pain, try an isometric exercise for that tendon, okay? And it's gonna change based on what tendon it is. You know, you're not gonna do the same isometric exercise for patellar tendonitis that you're gonna do for Achilles tendonitis and patellar tendonitis. You'll do different exercises to get that analgesic effect, okay? And if you're not familiar with analgesic effect, it means pain relief, okay? Once again, the science behind that is not well understood, but we do know that it helps. So, that being said, in order to improve over long term, it was once thought that eccentric or eccentric exercises was the gold standard for improving patellar tendinopathy or tendonitis, as it's commonly referred to. Now we know that it's actually going to be slow, heavy resistance training through the entire range of motion. Okay, this is the most updated science that we have. It's showing that, so for example, for patellar tendinopathy, doing squats, doing heavy knee extensions. Hey Tony, how are you? Good video last night, that was awesome. but slow, heavy lifting is going to be the best thing for you. So, and that's something that can be challenging for someone that doesn't have a lot of experience with rehab or with the recovery process. And you might want to have a rehab professional kind of guide you through that. You know, they don't have to be there for you all the time. Thanks, Tony. They don't have to be there for you all the time as you're going through the exercises, but I think it's certainly important that they kind of guide you through that process. And in future videos, we can give you some other tips as far as that goes. But I think that one thing that you can use to kind of guide your own self-treatment in this is that when you're doing these exercises, you don't want that pain to go above a 5 out of 10, okay? If it's a 5 out of 10 to start, you're not ready for this yet, okay? You need to calm things down first, okay? Maybe rest, not complete rest, but maybe do something that isn't straining the patellar tendon, okay? So maybe you can get on a bike if that's not causing you a lot of pain. It's gonna be different for everybody. You know, maybe go for a walk in the pool, go for a walk, you know, on land. Whatever, you know, gets that leg moving that isn't causing stress on that patellar tendon, try that. But so if your pain is somewhere around 2 to 3 at rest, when you're doing these exercises, you're gonna want that to be less than 5 to 6 out of 10 as you're going through it, okay? So use that as your guide. If it goes above that, you're doing too much weight. Okay, bring it down just a little bit. Another thing you might try is going through less of a range of motion, okay? Because the further down in the squat that you go, the more pressure there's gonna be on the patella and potentially cause you more pain. Something that you're just gonna have to experiment with on your own. And it's hard for me to kind of guide you through that without actually physically being there or seeing you on video. But just follow these guidelines and you should be okay. So the other thing would be if you're still having that increased pain over 24 hours after you did your strength exercises that we've been talking about, these squats, that's probably too much. Okay, you probably did too much. So maybe next time you go in and do it, back it off a little bit. Okay, anywhere from 6 to 10 reps is probably going to be okay. Just listen to your body when you're doing these, okay? That's the important thing. Your body's gonna tell you when you're doing too much. Okay, if you do feel like you have to run, don't be afraid to walk a little bit as that pain, if that pain for some reason does creep up. So, does anyone have any questions? Anyone who's on here right now? So I know this video is kind of creeping along. It's probably getting close to that 10-minute mark, but if you do happen to have any questions, please feel free to message me on Facebook. You can join the running injury support group if you're not already there. We do videos like this every single day between myself and Brianne Showman-Brown. Once again, this is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. Please feel free to give me any feedback on this video or ask any questions in the comments section. So I appreciate you watching and taking the time out for this. Concern with biting down to minimize range. I'm not sure what you mean with that, Christy. Why don't you send me a message and we can talk about it, okay? All right. Thanks for watching, guys.